I would like to share my experience deciding between a total thyroidectomy versus radioactive iodine therapy to treat my hyperthyroid. This is my personal account as a patient. Please do talk to your doctor regarding what's best for you and your condition. My hyperthyroidism was caused by Graves' disease, which means that it will always come back after a while without medication. The longest I went on without methimazole was about 8 months before the symptoms popped up again. My husband and I would like to have children, but getting pregnant while you have hyperthyroid poses lots of risks for both mother and child. Possible complications include miscarriage, preterm birth, stillbirths, thyroid dysfunction in your baby, maternal heart failure, and preeclampsia. I've been taking methimazole since I was first diagnosed. Hyperthyroid medication is not recommended while you're pregnant because there's a lot of scary, life-threatening birth defects. So after speaking to my endocrinologist and my gynecologist, I've decided to go with a more permanent solution for my hyperthyroid. There are 2 permanent solutions for hyperthyroidism: total thyroidectomy and radioactive iodine therapy. So with total thyroidectomy, your entire thyroid gland will be surgically removed. For the surgery, your thyroid hormone levels will first have to be normalized. And as for radioactive iodine therapy, you will be given a radioactive iodine pill to swallow, and it'll target your thyroid, gradually destroying it. Before the treatment, your thyroid medication will be adjusted to increase your TSH levels so that your thyroid tissues will be targeted better. My endocrinologist recommended radioactive iodine therapy as it isn't as invasive and will not affect future pregnancies. She gave me plenty of time to think about it, and since I have thyroid eye disease, I was told to speak to my ophthalmologist about the treatment. Okay, so let's talk about the risks and side effects of total thyroidectomy versus radioactive iodine therapy. Besides bleeding and infection, the risks are mainly related to the thyroid gland's location. Sitting on the back of our thyroids are 4 parathyroid glands that are in charge of regulating the calcium in our body. There's a chance that the parathyroid glands would be disturbed during a surgery, causing hypocalcemia. It's basically a temporary drop of calcium levels in our blood, but this is very easily treated. But if the parathyroid glands are permanently damaged, I would have to take calcium and vitamin D supplements for life. There is also the risk of injuring the nerves that lead to the voice box. It could result in hoarseness, voice changes, or swallowing problems. But my surgeon said that it rarely happens. Radioiodine has been a hyperthyroidism treatment for over 60 years and has been shown to be generally safe. But if you have moderate to severe thyroid eye disease, radioiodine therapy may worsen the symptoms. I have moderate thyroid eye disease. My ophthalmologist said to reduce the risk, steroids will be injected into my eyes before taking the radioiodine. After taking the radioiodine pill, you and your bodily fluids will be radioactive for at least a week. You have to quarantine yourself, not even sharing toilets and utensils with anyone else. Sometimes you can lose sensation in your mouth after radioactive iodine therapy. This is common but not permanent. For both, I will develop hypothyroidism and need to take thyroid hormone medicine for life, since my body will no longer be able to produce those hormones. For me, the risks and side effects of going for total thyroidectomy with a good surgeon is lower than the radioactive iodine therapy, especially with thyroid eye disease. So a total thyroidectomy it is. Ta-da! It's been 8 days since my thyroid was removed, and my surgical wound is healing well, and my voice box is okay. I developed hypocalcemia on the night of my surgery. It felt like my fingers were really stiff, my legs were very stiff, and my calves were like on the verge of cramping. And I've since been prescribed calcium carbonate and calcitrol. My doctor said that my blood works have shown improvement, not to worry, this is temporary. Again, this is a personal account, I'm not a medical professional. I hope that what I've shared can help you with your conversation and consultation with your doctor. Thanks for watching.